Patients are bearing the brunt, I'm afraid, of the Nehawu strike that's currently underway around the country. At the Charlotte Manqoba Hospital in Johannesburg, those who are seeking medical attention have been turned away and told to make appointments for another time. The striking employees, to remind you, are demanding a 10% wage increase. On the story for us, eNCA's Manqoba Mchunu is outside one of the hospitals and is joining us for the very latest. And this is not good news. Strike action or no strike action, we can't have patients being turned away who need urgent medical care, can we?
Well, certainly not, Gareth. And in fact, that is a concern of many of the patients that have been turned away here this morning, since the morning. In fact, Gareth, they're still being turned away. Even now, we're told by some of the patients that had gone inside the hospital that they were told, Gareth, that they will have to make appointments for other days. And these are patients, some of them who are seriously ill. There was a lady here that I spoke to who did not want to speak on camera, Gareth, was coming to do her chemotherapy, but she's been told that she'll not be able to do her chemotherapy today because of the ongoing protests and because many of the operations here have been disrupted. We understand that they are operating on skeleton staff, and so there are just about 1 or 2 nurses to each and every ward, and that tells you, Gareth, how dire the situation is now becoming here at the Charlotte Manqoba Hospital. And we've been seeing patients throughout the day that have been coming out. Some of them are being discharged from the hospital because the hospital says that it simply cannot be able to provide those essential services to them. Just a short while ago, there was a man who had gangrene, and he said that he was, supposed to be seen by doctors today. He had been, at the hospital, and he was told just a short while ago that he'll have to call his relatives to fetch him because he's being discharged. And so that tells you, Gareth, how serious the situation is. The elderly are also being turned away. People from homes that are coming from the various homes are also being turned away. We also saw a van from correctional services that had some of the inmates that were coming to seek medical attention also not receiving any particular help. And that just gives you a sense of how big this strike has become. And of course, on the streets, Gareth, you can see clearly the nurses, those essential workers are out on the streets. They're wearing their uniform, and when you speak to these essential workers, they tell you, Gareth, that they were prevented from coming into the hospital. So there have also been acts of intimidation here. As you can see, this is just one of the patients that is also being forced to turn back. And the entrances, Gareth, to the hospital, all of them have been blockaded by striking workers with rocks, and this means that patients will now have to travel long distances. In fact, I'm just going to step out and show you, Gareth. In fact, we're on the main road here, St. Andrew Street, just up from where the main entrance of the hospital is, and this is where the patients have had to walk up or walk down to get to the entrance of the hospital. And of course, when they get there, they are told that they cannot be seen. They will have to make appointments. They'll then have to come up this stretch of road and to come back here where they'll get transportation. I'm just going to ask Mohammed just to turn this direction just to show you what's happening here. This is the main entrance, and as you can see, there are still some groups of workers that are still here on the scene. But what we're seeing now are police officers also trying to remove some of the rocks from the street to allow for vehicles to be able to pass, because for the whole day vehicles have not been able to pass here. This means that those who were supposed to see doctors would have had to walk to go to the hospital. And we saw even people on wheelchairs, the elderly being wheeled up this stretch of road to come here where they're going to get taxis. And of course, many of them saying, Gareth, that they are really feeling the impact because they had come here, they had appointments to see the physicians, but they were unable to see those physicians. But I spoke to also nurses just to try and understand about their reasons for coming out in the streets. Of course, they are essential workers, and we know by law that essential workers, cannot partake in protest action if that's going to compromise the lives of those patients that really need it. And Gareth, we spoke to them earlier on just to find out exactly what their concerns are, what is it that they're demanding, and why they've decided to join the picket line. Take a listen.
I'm working as a nurse here. We are here to strike for 10%. If government to have failed us, we've been working as nurses kanzima kabi for ukuthi siyenzele government wethu ukuthi abe right, but yena akasicabangeli. We are here as strikers, sistrikela 10%, sistrikela ilona yezindlu, sistrikela yonke into na wonke umuntu, including mina. I'm working here as a contract worker, including nathi ama contract workers. Asisayifuni contract, sifuna ukuthi government wethu asirenewele aphinde futhi asiphe nama permanent ngoba we've been risking our life sisebenze lana for isikhathi eside, sisebenza under covid, icovid isiphathile. Now that government wethu akasasicabangeli, and then government wethu ucasha abantu from outside, meanwhile thina sikhona la. So we're here for that. Sifuna government wethu ukuthi as prioritize as abasebenzi bakhe, as we have risked our life.
And I asked the following question, Manqoba, of course, because I know how many patients rely on a hospital of that size. We're talking about patients being turned away for urgent medical care. Any idea how long they're going to be stopped from going in to receive the help they need? How long is this going to last? And what have you heard?
Well, Gareth, the workers have made it quite clear that they are going to continue with their protest. They're not going to stop up until government accedes to their 10% wage demand. Of course, at this particular point, government is offering 4.7%. The workers saying that this is ridiculous. It's an insult to them. So they're saying that they're going to intensify their protest up until government, heed their demand for a 10% increase. In fact, you can still hear some of the workers that are still here that, when the police came here just a short while ago to try and remove the rubble, to clear the roads, they had told police not to do that. They instead, returned and put those rocks back on the road. So the streets are still barricaded, and I guess the patients are still at the receiving end of this impasse between the workers and government. And they're saying, Gareth, that they're not going to return to work. So this is just the impact that we're seeing this afternoon of this particular strike. And of course, it means that many patients will not be receiving the medical attention and help that they're going to be requiring or needing from this particular hospital. We've also been trying to engage the health department just to try and find out as far as contingency plans are concerned and what their plan is to see that those that require help are attended to, because really we saw some people that were really sick, elderly, 89-year-old woman that I spoke to earlier on, who had come for a checkup and also to get a medication, not being given any assistance, and she was wheeled up in a wheelchair, and she had to take a taxi back to where she was coming from, Gareth, without receiving any medical attention. But the workers insisting, Gareth, that their protest will continue.
All right, then for the moment we'll leave it there. We'll come back to you again later to see if there's any more developments. Just outside the gates of Charlotte Manqoba Hospital is eNCA reports. Manqoba Mchunu will go back throughout the afternoon and this evening here on the channel. Now, another big story.